Good day, everyone. Thank you for staying with us up until the final lesson of the Family Link Education Program. So thank you for spending your weekends with us. It is not easy. Working in the field of mental health, caring for a person living with mental illness, and being a psychiatric patient, it is an uphill battle, and it is definitely a lifelong one. So no matter how you're feeling about your involvement in the mental health work, I'd like to say thank you, and let's hang in there. So over the next 45 minutes, what I'm going to talk about will be rights and advocacy. Somehow it may feel like some freedom fighters, so that's why the cover. So over the next lesson, I'm going to talk about the understanding of your rights, be it being a patient or being the carers of patients with mental illness. I hope that everyone can understand from this lesson that many of the cases are actually related to the environment and the policies, and to understand that advocacy is actually the best way to improve service system. And I would also hope for everyone to take home some basic advocacy skills. So before we start, I would like to show you the evolution of our psychiatric services to give you a better idea why we should advocate. So back in the 17th century, there were narrow, privately run asylums which confined the mentally ill people, and they actually handcuffed those aggressive people, as shown in this picture. And another 100 years later, there was this period of enlightenment in the 18th century, where they put more emphasis on the cleanliness, proper ventilation, and the clean food supply for the asylums. It actually saddens me to think that we even needed a revolution to actually fight for some things that we thought is some basic human rights for clean food, clean water, clean air. So towards the end of the 18th century, handcuffs and punishments were banned, and they actually introduced straitjackets. So for those of you who are not familiar what straitjackets were, they were actually jackets with very, very long sleeves, which are worn from the front. So instead of the regular shirt where we wear from the back, this is actually worn from the front. So after that, the very long sleeves will be guided towards the back of the patients, where it will be tied. So this is called some more humane way to actually confine their actions, limit their actions, so that they won't be doing any like damaging things to themselves or to their properties. And as for more stable patients, they were allowed to move about in the hospital compound, as you can see in the picture here, where the skies are blue, red roses too, and also they are able to enjoy the clean air and the outside environment. So another 50 years have passed, and this British politician, Lord Ashley, he came out with this Lunacy Act, where he explicitly changed the status of mentally ill people to patients who require treatment. This is a very important milestone, because he tried to induce more empathy towards this group of people, to patients who require treatment, to remove the fear and the labeling towards these people. And he actually compelled the construction of asylums in every county with written regulations and a resident qualified physician. And he also compelled regular inspections on behalf of the Home Secretary. And you can see another 100 years later, we have this Canadian sociologist, Irving Goffman, with a very important work, Asylum. So Irving Goffman is said to be the pioneer of deinstitutionalization. And you may be wondering, what is institutionalization to begin with? So institution is often said, for example, prison, for example, mental hospital, where the people actually live in an institution in a very mechanical way. Take, for example, the life of a mentally ill patient in a psychiatric ward. Every morning, they wake up the same time as the others. They bathe, they brush their teeth, they go for breakfast. So after that, they have some free time where they can do some leisure activities, maybe do some gardening. They learn some handcrafts, and then towards the end of the day, they will take their medications again, take their supper, go to bed. So day after day, this is a very mechanical way of living. So we actually take away their interaction with the outside world. They start to lose track of what is happening outside the institution. For some of you who may have watched the movie, The Shawshank Redemption, I believe you would remember one of the characters. It was a very old man who's around like say 80 plus or 80 plus years old. He actually walked into the prison as a 20 plus year old man, but after being imprisoned for more than half of his life, more than 50 years, he's been living in the institution. He doesn't know how to interact with the outside world. He no longer has the survival skills outside, and he is very fearful of going out into the community again where he does not feel belonged. And although we might think that because of good behavior and he was being discharged into the community, we may think that we are allowing him freedom. We thought that we are doing good things to him. But actually, it is sort of cruel to him because you send him to the community without actually preparing him for the community. And this character actually ended up taking away his life. So this is a very sad case, and I think it may be applicable to some of our patients as well, where they are in the psychiatric hospital for too long, they no longer know how to live outside. So this Irving government, he converted the psychiatric hospitals into the community mental health services, i.e., for those more stable patients, they can actually receive treatment where he introduced the mental health services, they bring it to the community. All right, so moving on to the Mental Health Act. So around 40 years later, in Malaysia, we have our very own Mental Health Act, where it includes the admission and detention procedure. It tells what are the basic requirements for the amenities in a psychiatric hospital, what are the nursing care and observation, the standards of practice, the SOPs, the community rehabilitation, and the protection of mentally disordered people. Under Mental Health Act, it says that a patient may request for admission into psychiatric hospital as a voluntary patient. And if a mentally unstable patient is unwilling to be admitted, the relatives may then apply for admission, where a registered practitioner may order for involuntary admission, having assessed the patient. The patient or relative, after the admission, they may actually apply for the discharge of involuntary patients, and the hospital will then conduct a mental state assessment for the patient. So you may realize the word relative actually appears a few times over my talk, and they actually play a very important role. So under the Mental Health Act, they gave a clear definition on who are the relatives. So the legal relatives include the spouse, the husband or wife, and the children. It also includes the parents or siblings. Moving up another generation, it also includes the grandparents and the grandchildren. It also includes the uncles, aunts, nephews, or nieces. So this is the definition of relatives under the Mental Health Act. So some of you may be wondering about the human rights. There is this dilemma because is it ethically correct to restrict the basic freedom of these mentally unstable patients? And how do we justify this violation of freedom? So this is something for us to think about. But for me, health, according to the WHO, the World Health Organization, health actually constitutes, apart from physical health, it also talks about the mental health. So while they do have the basic freedom, but when these group of patients, when they lack capacity, probably because they are actively suicidal, probably because they are very, very psychotic, they are too paranoid to come up with a rational decision, they don't have the capacity to request for a discharge and not to be admitted to a hospital, that's where we need to champion the rights for them to attain mental health, because with treatment, these mental health conditions can actually be controlled. So this is how we justify the violation of freedom. And as much as possible, as I said, the most stable patients, they will be allowed home where continuous community team will be assessing them, and they may also be referred to occupational therapies for them to actually refine their living skills. So we may think that, yeah, there are so many pioneers and there are so many people, fighting for their rights. So why do we have to still advocate right now? So to answer this question, I would like to give you another question. So think about what are the barriers for people with mental illness to receive optimal care. I'll enlighten you in this slide. For a person to achieve recovery or go for a rehabilitation, there are a few major obstacles that they need to go through before they can get to this point that we all like to see. So first of all, they need to recognize the problem and then seek the treatment. And even after they seek the treatment, how well can they actually adhere to the treatment? So I'll break it down one by one. In order to recognize a problem, educational level plays a very important role, whether it is the education level of the patient or for the family members or the community, because it affects the public's knowledge and the attitude towards mental health. When the community is more tolerant towards people living with mental illness, then these mentally distressed people will be less fearful about recognizing or labeling themselves as, yes, I do need help. Sometimes they are very afraid to admit that I actually need help. And media reporting definitely plays a role as well. And I'm going to highlight about this later on. So before they seek treatment, they have to go through their own self-stigma as well. And I believe self-stigma is there even before or even after they started seeking treatment. A lot of times I hear patients asking me, doctor, I just come because I cannot sleep and because I feel a little bit stressed. It's normal, right? I'm not crazy, right? So actually, I feel that there are a lot of times the patients actually have this self-stigma that they think that, oh, by going to a psychiatric clinic, they are actually crazy and they are losing control. So there's a lot of self-stigma here. And before they start seeking treatment, they will also be thinking about the family's worry, their expectations. What if their bosses know about this? They are worried about their own employment and their financial status. And it is sometimes easier for them to deny the problem. So these are the obstacles before someone actually actively seeks treatment. So after they started seeking treatment, in order to make them adhere, for them to come for a subsequent follow-up, the healthcare staff's treatment is very important. If the patients can feel welcomed and feel respected when they go to a psychiatric clinic, then they are more likely to go for another follow-up session because they feel comfortable in opening up to the doctors and telling the problems. And whether they receive adequate explanation plays a vital role as well, because sometimes if the doctor just sit there with a stern face, listen to the patient's problems, write the prescription, there you go, I'll see you in 3 months. So the patient do not feel that they are empowered with explanation, with the knowledge of what they are actually facing. So the patient may be deterred to go back to the doctor again. It's like, seeing doctor, same one lah, never explained to me also, you see? And the medication itself, whether it is efficacious and what are the side effects from the medications is also very important. Yes, medications do sometimes have side effects, because no medication is perfect. But I believe that with adequate explanation, sometimes if the doctors just tell you before, so when the patients do expect these side effects, they will be more likely to think that, okay, this is an expected side effect, doctors have told me about it, so let's not panic and just continue taking the medications until I start seeing the efficacious effect. And lastly, accessibility to healthcare is also very important. Imagine someone living in a rural area where the nearest hospital is probably like 40 minutes away. So they may be thinking that instead of forking out another 30 ringgit on a Grab or on a cab, to go to the hospital, like maybe I'm feeling slightly better. Not perfect, but I'm feeling slightly better. So I guess I'll just default. I'll just skip the treatment. I'll just skip the appointment. So accessibility is also something that our stakeholders need to think about. So if they can go through these challenges, then we can get the patient to rehabilitation. So yeah, you got me. Yeah, I understand why we need to advocate, but why me? So it is because you are the best person who understands the needs of the patients with mental illness. And we always believe that help comes to those who help themselves. And the power of advocacy can actually change policies, bringing benefit to every patient. A small example would be sometimes when a child, maybe a 4-year-old child, say, was recently diagnosed with autism, and we will talk to the parents about registering the child as an OKU, because there are some benefits to being registered. For example, they will get this allowance every month so that the parents can actually use that money to send the child to occupational therapy, to some swimming classes, to help in the rehabilitation of functioning. But some of the families, they may think that they will tell that doctor, it's very pitiful for the child to actually bear the label of being an OKU at the age of 4. Why should I still register it? I don't want to label my child as an OKU. And I think my family can actually afford, without getting the allowance from the government. Why should I still register my child as an OKU? So this is where we need to educate them, because if there are, let's say, 100 of child being diagnosed with autism in a community, in a small district, and if we get all of them to register themselves as OKU, this is where, when the Ministry of Health, when they do the survey, they will realize that, oh, there are actually a lot of patients with autism in this area. So we probably need to build slightly more special schools, or we should start training more teachers who are able to teach, to guide this group of special students. So this is where a small act on your part of registering an OKU status, this is how cumulatively it can help to raise the statistics, and so that our stakeholders are aware that yes, there is a surge in the need for special school, and therefore we may change some policies. We may start training more doctors, more occupational therapists. We may start training more counselors in that area. So our status quo is owing to the hard work of the people in the past, and I do hope that when we continue the current efforts, it's going to benefit the patients in the future as well. So now, what is advocacy? So advocacy is actually doing your best to fight for your deserved rights, and at the same time correct some unreasonable, unfair social situations. So there are a few levels of advocacy in terms of individual level and the social level. At the individual level, you have to stop feeling the need to hide your identity, and you have to stop feeling intimidated by negative responses. You need to start defending your rights for optimal care, and you have to regain some self-confidence, self-esteem, and dignity. And at the social level, we often see problems in employment, in the promotion at work, and also insurance, because some of the insurance I think most of the insurance companies in Malaysia do not entertain patients with mental health problems, but actually there starts to be like 1 to 2 insurance companies who are starting to cover mental illness, which is actually a shift in a paradigm. So we see that by changing the society, we can continue to fight for fair opportunities for this group of mentally ill patients. And in order to convince the other people, we need to tell ourselves that impairment and disability does not equate to handicapped. Yes, we cannot change the fact of the illness, but what we can do is to foster the changes in the healthcare and social system, which directly affects people's chances of relapse and recovery. Advocacy at individual level, there are 5 main points I'd like to highlight here, and I hope everyone pays attention. Mental illness is not an issue of the minority. So take schizophrenia as an example. The prevalence rate is about 1%, meaning if you were to catch 100 people in the population, it is very likely for you to catch one of them with schizophrenia. So it is definitely not an issue of the minority. It's not something super rare like the unicorn. Mental illness is a treatable brain disorder. That's why we're advocating for accessibility to the healthcare services. Very few, and in fact there are less than 5% of the people actually living with mental illness will display violent behavior. Discrimination is absolutely wrong and it must be stopped. And getting the illness is not a sin. So it's just the same thing, like you do not blame someone with bronchial asthma. You do not blame someone for having diabetes. So likewise, getting the mental illness is not a sin. It is not like you are actively looking for the illness. So stop the blame. Mental illness does not equate to violence. This is very important, therefore highlighted in bigger font. Even if the mentally ill patients, they do behave aggressively, most of them were triggered at the moment. We have to understand that anyone could have reacted aggressively in the face of provocation and discrimination. This is a fact. Yet we have to understand the probability of mentally ill patients being provocated or discriminated are often higher than the general population, which is not entirely their fault at all. And note that I highlighted it in caps lock and also red font, untreated patients. Untreated patients with schizophrenia and bipolar mood disorder, they have 6 times higher risk to behave aggressively, but this is only because they are untreated. Therefore, aggression is closely related to illness control. It is easy for humans to find simple explanation to some bizarre, abnormal behavior, and mental illness is often the most commonly abused explanation, which is very unfair to the people living with mental disorder. So what are the patient's rights? Well, we have to understand medical staff, they are not superior to patients, and patients can also make shared decision in treatment plan. And there is a new movement where the concept of shared decision making is being repeated in a lot of workshops nowadays. So patients, they do have the right to get explanation on the illness, the treatment plan, the benefits and side effects of the medications, and they also have the right to a prescription which is not limited to the available medications from the treating center. Take government setting, for example, and some more sophisticated drugs like Persatuan or some paliperidone. So there is a quota. The quota as in how many patients in government hospital are actually entitled to the free medication. So maybe like say there are 10 patients per year, but what if you are out of the quota? What if you get diagnosed later and there are already like 10 existing patients who are enjoying these medications? But still, we need to inform the patients about, look, there is another type of medication you may benefit from, and if the patient can actually afford, then why not? So you actually have the obligation to actually tell them there are other resources out of what is available in your treating center. And as doctors, we should not assume or limit your patient's choices just because you think that, it's probably unfair to tell the patient to buy, so let's not tell him. You should still tell them. And also, patients, remember, can complain against any unreasonable treatment by the medical staff, and they reserve the right to take legal action. But I understand with great power, with rights, there comes responsibilities as well. So I hope everyone can understand that while patients have the rights to all these bold information, you have the responsibility to know about these as well. So every time a patient walks out from the clinic, I hope they actually understand, or at least their family members understand what kind of illness he's suffering from, what is the treatment plan, what are the benefits and side effects of the medications, so that in case the patient comes back and not see the same doctor, at least you can convey these information to the next treating doctor, which will definitely ease the consultation process. So this is the responsibilities on the patient's side as well. Okay, moving on to side of complaint, how to complain effectively. A lot of healthcare practitioners, they actually shy away from the word complain because they think that, yeah, with complaint, then the superior will be blaming us. But we believe that complaints, if it is done properly and through a proper channel, it can actually help us show the stakeholders that, look, there is such a necessity to improve our facility. So how do we advocate? What are the skills and the tactics? Number one, you can choose to meet with the authorities or the public relation officers known as the PRO in the hospital. But when meeting them, remember, your aim is to solve problems and not just to ventilate your anger. And do not assume that they will disagree with you. You can express your opinions with good manners, on reasonable grounds, and work on a rational discussion. And try to write down the details of meeting for future reference. The details, for example, the date, the time of the meeting, who were involved in the meeting, and what were the agenda, and when was the proposed follow-up date, so that it is easier when you go back to the PRO and ask for any follow-up. You may also have a written complaint, but remember, as you write the letter, don't adopt a threatening tone because it will make the other party think that you are unreasonable to begin with. And the content should be fact-based, and you should state the subject matter and the names of the parties involved as clearly as possible. It is not good enough for you to say that, okay, I vaguely remember like a few months ago, there was this staff nurse involved who was talking very rude, and you can't really tell what was the content. And I vaguely remember there's someone else who came and stopped the fight or stopped the quarrel, and I would like to complain about that. So this actually reduced your level of persuasion, because there were a lot of lacking details there. So the investigation process will be a little bit difficult. And after you write the complaint, try to include your contact information as well, because anonymous complaints are less persuasive. And as much as possible, you should leave your contact information and then request for a reply, because this is what you deserve as well. Because what you are doing, apart from getting a closure on your own, you are actually hoping that the future patients do not suffer the same maltreatment or the same injustice that you have faced previously. So therefore, you do reserve the rights to have a reply after the hospital investigated the whole thing. And you may also get some external support. Use your resources effectively. You may get support from other people with mental illness and their family members who have had similar experiences. You may also strive for the support from the professionals. Make good use of the media, and by media, I do not mean that, viralize the issue on social media, where a lot of emotional people will be giving some comments and thereby blurring the focus and blurring the main target to actually solve the problem. The media I'm talking about is like letters to the editor in a newspaper, or make use of the complaint hotline, and etc. And as promised, I'll talk about mass media. To curb discrimination towards patients and their family, mass media, they have to receive proper education and information. Mental illness has long been associated with suicide and violence in movie productions, and this is very misleading. And it's actually a good thing that after some propagation and some awareness, some advocacy, we are seeing less and less movies which talk about mentally ill people being like super violent, super aggressive out of nowhere. What are the importance of responsible reporting? Is because when reporting is done in an improper way, it misleads the public about the real experiences of mental illness, and it actually reinforces misguided beliefs that people living with mental illness are dangerous, making it unlikely for people experiencing mental distress to seek for help because they felt that the self-stigma is too strong, they are afraid of the societal perception. And improper reporting also increases the feelings of shame and isolation for people experiencing mental distress. But on the other hand, when reporting is done properly and nicely, it can help change public misconceptions. It challenges the myths and educates people about mental health, and it can also change public's negative attitude towards people with mental illness, thereby encouraging people in distress to seek help and promote hope and recovery. So these are some of the examples of the new wordings that we hope that the media may adopt. Like, instead of saying the person is mentally ill, it is like defining the person with mental illness. But you can say that the person is living with mental illness, because you still respect the person's own way. You have to respect the person's own way of describing their experience. He's still a person after all. The only difference is that they live with a mental illness. Mental illness is a strange, scary, and sad. Well, this is so yesterday. Don't portray mental illness as a very hopeless situation, that's something that someone suffers with forever and cannot recover from. The media has the responsibility to advocate that mental illness is not forever, and we hope that the media can continue to tell stories of hope and recovery, include some positive narratives that show people recovering and living well, so that it can help encourage people with mental distress to move forward and seek treatment, take that very first step to recovery. In fact, the World Health Organization also came out with a guideline about suicide reporting. So what are the do's and don'ts in suicide reporting? So in terms of the do's, After telling news on suicide, do provide accurate information on where to seek help, and also educate the public about the suicide facts and prevention without spreading myths. As much as possible, report stories on how people cope with life stressors or suicidal thoughts, and practice extra caution when reporting celebrity suicide so that not to make it very sensational, making it very dramatic. Be cautious when you're interviewing bereaved family or friends. Be very tactful in some of the words you use. And remember, media professionals may also be affected by stories about suicide because it is not an easy thing to look and actually interview a bereaved family members. So what are the don'ts? So do not place the suicide cases prominently and unduly report such stories, making it like an entire page about the suicide. Don't sensationalize it. But very importantly here, I'd like to highlight is that do not normalize suicide either, and don't present suicide as a constructive solution to problems. And don't explicitly describe the method used in fear of some copycat suicides. They may actually copy how other people do it. And don't provide the details of the location. And do not use the photographs, video footage, or the social media links. Because when we unduly report these things, people will be more focused on finding fault on who actually caused the suicide, and they will be pointing fingers. This is blurring the focus on how to solve the problems and how to promote coping skills. So these are the don'ts in the suicide reporting. So as the caretaker, remember that you are not alone. You may empower yourself by, for example, joining the support groups or joining more seminars like today, to upgrade your mental health knowledge. Remember to develop your coping skills as well, because it is not healthy for us to keep panting up our frustration or disappointment. So you need proper channel to release your stress as well. And it is only then that you can advocate for your loved ones. And remember to be nice to yourself. I'd like to end the lesson today by a quote from Helen Keller, an American author that I like a lot. Although the world is full of suffering, it is also full of the overcoming of it. Alone we can do so little, together we can do so much. Before I end my session, I'd like to ask anyone recognize the painting in the background. I think it's quite hard for us to have interactive sessions in a webinar, so I'll just tell you. The painting is The Starry Night. The Starry Night by Vincent van Gogh. He actually painted this in the year 1889 during his stay at the mental asylum. He has schizophrenia, and some say he also has epilepsy. He had relapse after relapse when he started having hallucination and suicidal thoughts as he go into depression as well. But in The Starry Night, even though it's dominated by the blue color, Van Gogh conveyed the strong feelings of hope through the bright lights of the stars. As you can see, the stars and the moon. And no one had been able to use their passion and pain to portray the magnificence of our world. And it is said that Van Gogh actually lived in an era where there was no antipsychotic, no proper treatment for his schizophrenia. Had he lived in our modern world, he may have a very different quality of life or very different ending. So we can see the lack of technology and medication back in the 19th century has limited Van Gogh's opportunity to be treated. But think again, while we have the luxury of treatment availability in this modern world, the next phase of our advocacy, say for the coming 50 years or 100 years, would be to increase the awareness and the accessibility to the treatment options. So with that, I thank you all for your kind attention, and I will pass the floor back to the MC.